But the real reason I'm here is to try and just fundamentally help people. And I'm an immigrant. I came to America with 2 suitcases, here with carving out my piece of the American dream. Came here as a young veterinarian, eager to make a difference. And one of the things that I learned about America is that there are a lot of people in this country who care about animals. And in particular, for what we're going to talk about today, we're going to talk about dogs. And there's a particular problem that dogs get very commonly that causes a lot of confusion in people. I see people make some mistakes with decision making, and I see people make good decisions, and I also see people make decisions that may be good or bad and hard to tell the difference. And ultimately, as a veterinarian, an animal doctor, none of our patients talk to us, and none of them give feedback. And how do we all know as human beings if we're doing the right thing or not? And that's my area of passion and expertise, is to try and sort out what is fact from fiction, and at least my fact from fiction, or my truth, or my representation of the truth. And the reason that I feel qualified to talk about that is, for just about 30 years, I have, on a weekly basis, talked to someone about a dog with this type of problem. It's a knee problem, a ligament problem in the knee, at least once, if not 7, 8, 9, 10 times a week, as well as done many surgeries every week to address knee problems. And I've done this over and over and over again. I've also done original research when I did my residency at the University of Wisconsin, where I looked at the molecular level of damage of the ligament in dog knees and what happens in there. And also, over the years, have had many different experiences with different types of knee surgeries, including I was one of the first veterinarian in Florida to perform total knee replacements in dogs. I've had experience with synthetic ligament replacements from a surgeon in France. And I've done all of the commonly standard of care accepted surgeries in dog knees over the last 30 years. And there are some things that I've learned that want to try and give to people to stop them from having to have their dog's knee have surgery. So the problem that we're going to talk about is something called cranial cruciate ligament injury, or CCL. And this is something that I've spent many years thinking about. And what the knee is of a dog is just like you or me. We have knees right here, but dogs walk on all 4 legs. So when they walk like this. They walk flexed over like this. And if you were to look at the model of a dog's knee, which we have right here, we have a femur bone, tibia bone, and in the front of it, the kneecap and what's called the patellar tendon. A lot of people think this is the ligament, but if you look inside here, you will see 2 ligaments that crisscross, and these are called the cranial cruciate and the caudal cruciate. Now, they're the same as the anterior cruciate and the posterior cruciate ligament in people. We just call it cranial cruciate because dogs walk on all 4 legs. It's just a terminology thing. But in terms of what we use interchangeably, cranial cruciate, caudal, anterior cruciate, they're all the same thing. And what happens is many people will experience a dog that starts to limp and hold the leg up from time to time. Dog will be running around, favors it a little bit, sometimes holds the knee a certain way, flops it to the side, sometimes preferentially maybe holds the leg out to this to one side. And this will sometimes cause puzzlement and bewilderment from time to time. A lot of people think it's a hip issue when they see this, but 9 times out of 10, or very, very commonly, it will be a knee issue. And what's happening is inside the knee, the dog is starting to wear this ligament. And again, it's called the cranial cruciate ligament, or CCL. And it is like a rope with hundreds of thousands, if not millions, of little fibers. And dogs are very prone to damaging that. And what is very, very common with dogs is to be able to run around, to have inherent athletic ability. They're wonderful creatures. They got no ability to think for themselves. They just live in the moment, and they're going to have fun, whether or not that's chasing a squirrel, a rabbit, frisbee, going to doggy daycare, seeing the neighbors' dogs, having play dates. They're going to run around and have fun as long as you'll let them do that. And in addition, because they're very active and athletic, they live in an environment with people. As animals, we are very large compared to dogs. Average human might be, say, 4 or 5 times the size of an average dog. We're like giants. And our environment is designed for giants. And so a couch to a dog would be the equivalent of a massive couch for us. But the dog is going to be able to just jump up on top of that couch very, very easily. And that's equivalent to you or I jumping 4 or 5 feet easily. And because dogs do this all the time, it leads to a fundamental risk of damage to the ligaments in the knee. So everything that a dog does every day is normal life predisposes to damaging the ligament in there. The second thing that also is prevalent in dogs is a high genetic predisposition, which is multifactorial. Genetic being things like body type, muscle strength, the way the bones are shaped, which is called conformation, how much fun they like to have. Dogs have got different personalities, as well as just tissue weakness in some dogs. So you can't pinpoint this as one factor, but the genetic umbrella means that beyond environment, what dogs genetically made up are going to predispose to this problem. So this means that there are hundreds of thousands of dogs every year, if not millions of dogs every year in the United States, that start to limp on the back leg because their knee hurts. And because they can't say, hey, my knee hurts, they're going to often get taken to a veterinarian who is going to do some examinations and maybe some testing, and quite often will diagnose a knee problem. In the early stages of this, however, it can be very, very difficult to diagnose a knee issue because there may not be enough exam findings to support it being a knee. And of course, dogs can't say, hey, my knee hurts, what should I do about it? If they did, I would say, stop running around so much. Warm up a little bit before you start running around, and just take it easy. But movement, because it's so fun, can predispose to these types of situations where that little ligament in there that's made up of hundreds of thousands of little fibers is starting to wear. And when it starts to wear and become disrupted, it will then create inflammation inside the knee, and ultimately the beginning of arthritis, which is just inflammation in the knee to try and stabilize it, and progressive damage and tearing of the ligament until it becomes very obvious that something is not right. And because this is still largely a random event in terms of how it tears and frays, that could occur. You can't predict when that's going to happen. That could happen in a 1-year-old dog. It could happen in a 10-year-old dog. It all depends. And it may happen fast. It may happen slow. But eventually, pet dogs will start to limp so much that something clearly is wrong, and a more accurate diagnosis can be made of cranial cruciate ligament damage to the knee. Now, the knee is a unique joint It is the only joint that is put together with two ligaments, and it hinges perfectly every time it walks. And in order to hinge something like this, depending on what you want to believe, whether or not it was evolution or design, I feel it's a little bit of both. The only way you could get a knee to stick together like this is to have ligaments in there. It's the only joint in the body that has two ligaments that are essential for stability. And for that reason is the most likely to be damaged and cause signs. There is no other joint in the dog's body that has two ligaments. And consequently, those joints are more resilient to wear and tear. What also causes people a lot of bewilderment is this can happen in young dogs, like 1-2 year old dogs. And quite often in those young dogs, pet owners will comment, listen, when the dog was a puppy, something wasn't right, and they couldn't figure out what was going on. And by the time the dog is about 1 year, 2 years of age, it's got a full-on cranial cruciate ligament injury. And this can cause people a lot of confusion and bewilderment because they didn't sign up for that. They thought that their dog was a perfect, genetically sound animal that came, sometimes if it's a purebred dog, if it came with papers, they equated that as meaning product soundness. And I don't want to sound like I'm being callous in that respect, but the mentality that people have is, how on earth can this happen in something so young? And the reality of it is it does. And there are even young people, athletes, who are injured in high school and through athletic pursuits that then become sore, maybe arthritis in their joints, simply because they did too much. In the general dog population, every dog is a high school athlete. Every dog can run faster than any human being in track and field without any training. And every dog every day lives its life in a fantastic obstacle course, in a life of fun and happiness. And these factors are there as potential causes of ligament damage. And I'm not advocating that people shouldn't have their dogs run around, but at the same time, think about what the consequences of movement can do and how that relates to damage in the ligament. So once a dog has had a diagnosis of a cranial cruciate ligament injury made, the next question is, what should you do about it? And surgery is the most common thing that is recommended for this problem in dogs in the United States and anywhere in the developed world where dogs have surgery performed on their dogs on their knees. I'm a believer in surgery. There is a right time for surgery, but in veterinary medicine, there is no uniformly accepted standard for what type of surgery should be done, and also the timing of surgery that should be done. And so, again, it comes back to the fact that there's no ability to get feedback from the patients. There are studies that have been done that show a positive benefit for having surgery. However, the types of surgery that are done do not restore 100% function. And in my practice and in my preference, when I try to counsel people on the timing of surgery, I really look at how much the dog is limping on the leg. And the worse it gets, the longer it goes on to where it's much more obvious that something needs to be done, what I call the 50% rule. The dog is using the leg less than 50% of the time. Other analogies I like to use is this happened over a period of months, and you had a lameness that comes and goes and then comes more than it goes, or if the dog has just stopped using the leg. And if the diagnosis is accurate, surgery is a good thing. There are some other problems that can mimic the CCL injury. it needs a surgeon or a veterinarian who is capable of diagnosing it to make the right call. But once the call is made for surgery, there are different options that people can pursue. Now, in terms of trying to avoid surgery, in terms of trying to get by without surgery, I've got bad news for 99% of pet owners out there. There is no dog that is commonly available that will not be at least predisposed to ligament injury. There are some dogs that it almost never occurs in, particularly greyhounds, as well as some other breeds of dogs. However, if you own a dog, no matter how big or small it is, you are at risk for this problem developing. And once there's a tiny little tear inside that ligament, the ability to self-heal it to go back to normal is very limited. The best you can do is start to modify activity level to reduce the stresses on the knee. That's the healing, so to speak, or the damage control. And in the between space between limping a little bit and limping a lot to think about surgery is the opportunity for diet and exercise as well as nutritional supplementation to try and help joint health. So the folks here at Healthy Bite have got some products that have been specifically formulated to help dogs with their joints, their joint health, as part of a plan to reduce the level of force on their joints through diet and exercise. Really, in summary, we have a problem with dogs in the United States, and that is that they enjoy their lives with their pet parents, and they like to run around and chase things and live their lives. And we're not going to mandate that they have a non-fun life. We're not going to chain them to a couch and not make it so that they cannot run around again. We're not going to treat them like they're fragile items. We're going to try and work with a deeper understanding of the fact that when they run around and move, that maybe they just take a little bit of time to get up to that full speed. We treat them like athletes. We are mindful of their body weight, and we try to strive to ideal body weight, even though that's a challenge for all of us, for dogs and people. But we're also fundamentally going to look at trying to buy a good quality joint supplement that has the building blocks for joint health formulated in there, that has been selected carefully, sourced carefully to be the very best quality possible to help you in your journey to have optimal health, optimal movement with your dog, and keep their knees in as best condition as possible, and try and avoid surgery if possible also.